Hi guys, today on Joy Wellness Partners Lunch and Learn, I want to talk about menopause and andropause. Menopause, you probably heard about it before because your mom and or somebody in your family was going through that process. Andropause, however, it's the same thing as menopause, but it happens to men or male. Andro in Greek means human male and pause means cessation. And I also put fingerprint on top of it because menopausal and andropausal symptoms are like fingerprints. You won't find two identical copies. So your symptoms might be completely different from your friend's symptoms. So what we're gonna learn today? We're gonna learn about hormones and hormonal changes that happened with age. We'll understand the role of testosterone, estrogen, and progesterone in men and female body, and also the timing of hormone replacement therapy for both gender. So, what is the definition of menopause that I found on Google? So, menopause is the end of a woman's menstrual cycle. That first definition does not say anything about hormones, you just talk about menstrual cycle. So that's why I don't like it. The second definition says it's the time of life when a woman's ovaries stop producing hormones and menstrual periods stop. But some hormones, unfortunately, are down way before we stop menstruating. So we can have very low hormones and still menstruate. Last definition says menopause is a point in time 12 months after a woman's last period. That's very, very specific. That only works if we're all robots and we all the same and we have the same body. And then, yeah, maybe it's always like that for every single person, but it's very specific. So, officially, menopause marks the end of female reproduction. By then, women's ovarian hormone levels are very low. The problem is that the effect of hormone decline can be felt way before menstrual period ends. Also, women are often infertile and stop ovulating way before the end of menstrual cycle. And that's what I want you to understand from today's lecture. And I'll talk about it a little bit more later. Andropause, like I said, it's a condition that is associated with the decrease in male hormone, mostly the testosterone as the main male hormone. Testosterone is also main hormone in females' body too. Just a fun fact. We have more testosterone when we're young than we have estrogen in our bloodstream. So let's talk a little briefly about those definitions because I think they're confusing for a lot of people. So premenopause, it's the time of your life when you don't have symptoms of perimenopause or menopause. So any young menstruating woman is in premenopausal phase. Perimenopausal phase, it's on the other hand means around menopause. It's also known as a menopause transitional phase. And menopause, it's when we know what's menopause. We were just trying to find out the perfect definition for it. What actually happens? By definition, menopause and andropause happen when there is a major decline in hormones, but we are actually depleted many years before that. So that's why we should understand that that is the time when there's major decline of hormones. And that doesn't mean necessarily we have to replace all the hormones when they're already completely depleted from our system. We can start replacing them sooner to prevent all the horrible side effects. So this is the hormone timeline for both genders, at least the levels, how they drop. So first we have robust of hormone production, first in the early or mid-teens, and then it peaks in the late teens and early 20s, and it gradually declines from that point on. That the aging starts right after puberty ends. Women used to have dramatic drop of progesterone and estrogen in early 50s. However, recently I see more women with menopausally low progesterone levels in their early 40s and huge decline of testosterone level for both gender in mid 30s. So like you see here, estrogen drops way later, like progesterone drops way sooner in the early 40s. So this is when women enter the period called estrogen dominance. And that's when the progesterone drops, estrogen takes over and cause all those horrible symptoms mentioned here, like PMS, hot flashes, vaginal dryness, brain fogs, and all of that. And then in late 40s, we start losing our estrogen, and in the 50s, estrogen drops, and that's when we start noticing the symptoms of low estrogen. For men and women, both of the genders, testosterone start dropping in their 30s, and that's when they start noticing drop of testosterone. So on average, drop of testosterone is about 1% per year after age 30 for both genders. But ongoing research shows a decrease that are unrelated to aging. So we can lose testosterone in our 30s. I've seen testosterone being half because of stress hormone cortisol. In acute stress level, whether it's like mental stress from thinking about like stressful events, or stress could be from eating too much or not eating enough. Overworking out is a stress, and also not working out enough is a stress. So all that stress increases cortisol, which is a stress hormone. And that cortisol is anti-testosterone and anti-progesterone. So high stress level can make us go through menopause and andropause way sooner. That's why a lot of stress out women start feeling menopause symptoms in their early 40s. So let's talk briefly about regular menstrual cycle, so we can compare it to the cycle for perimenopausal women. So in this illustration, like you see, we have a couple hormones: estrogen, progesterone, LH, FSH. During a common 28-day cycle. So first, estrogen levels are very low during the first 1 to 5 days when we are menstruating. Then peak rise in a mid-cycle, then sharply decline, and then rise again in the last 2 weeks, and then decline to low levels again. However, progesterone secretion follows completely different patterns. So progesterone levels are quite low until mid-cycle. Then ovulation happens, which is the release of the egg from the sac, and that sac starts producing progesterone. So only and absolutely only if that release, if that ovulation happens, we can only produce progesterone if we ovulate. And progesterone rises way higher than we can see on this picture. So look at that photo. This kind of shows more how high progesterone can get if women actually ovulated. Remember that progesterone is not needed to menstruate. Estrogen is a hormone that makes us menstruate. So what is the difference? Yeah, what's the difference between ovulation versus menstruation? So the level of estrogen actually determine whether or not women will have periods, because adequate estrogen levels are required for the formation of thickened uterine lining called endometrium. And that's that lining that we are shedding and menstruating monthly. So menstruation can happen and ovulation might not happen in between, because ovulation is the process in the mid-cycle when the egg is released from the ovary, and then progesterone is produced from that release. So it's possible for women to menstruate monthly, especially in her 40s, and actually don't ovulate. This happens due to progesterone decline, but still sufficient amount of estrogen. So having monthly period doesn't make you fertile. A woman does not need to ovulate to have menstrual cycle. So let's talk about all those three hormones that both gender have. Testosterone, like we know, builds our muscles, makes us more motivated, helps to burn fat, increases libido. And then we have estrogen and progesterone. So think about estrogen as a stimulating hormone and progesterone, the one that quiets. I talk about them as like two sisters. So if those two sisters, the crazy fun sister estrogen and the quiet responsible sister progesterone, when they hang out and go out, everything is in harmony because they balance each other. But when we start losing that progesterone, then estrogen takes over. And that's when this overstimulation of estrogen starts causing a lot of symptoms in our body. So estrogen stimulates collagen production, so makes our skin doesn't age as much, our hair are healthier and longer. But also estrogen stimulates breast tissue, which is good because it prepares them for possible breastfeeding, also stimulates our uterus to form endometrial linings, so prepares us for pregnancy, for fertilization. However, estrogen, if it's too high and it's not balanced with progesterone, can cause overstimulation of those tissues. Also, estrogen has some additional function. Estrogens mobilize the stress response to support fight or flight. So think about good level of estrogen as like really good skin. So when the elderly people, men and women, start having low level of estrogen, they start having this like paper-like skin because it drops collagen production. They start having hair loss, weak joint and cartilage because we need collagen to build those cartilage in our joints. But progesterone, on the other hand, quiets, it balances estrogen, it calms the mind, helps with sleep, helps with anxiety, balance blood sugar, prevents heavy periods by calming overactive endometrium. They even did study that they put progesterone cream on a fibrocystic breast, and that progesterone cream quiet down the overstimulation from estrogen on that breast tissue. And other benefits of testosterone, especially like for men: vision, memory, mobility. Think about increased libido, increased sense of emotional well-being, increased muscle mass, strength, easier to burn fat, maintain memory, helps with skin sagging. It can maintain strong bones because low testosterone leads to osteoporosis, which are holes in the bones. It can elevate norepinephrine in the brain and aids with pain control. So when there's early decline of progesterone, there's insufficient progesterone to balance the stimulatory effect of estrogen. Many times women do not think of themselves as being in perimenopause or menopause if they are still having periods. And this is exactly the time to balance their hormones with HRT to prevent all those horrible menopausal symptoms. What causes early cessation of progesterone? Because like I said, in the past, we used to have a drop of progesterone and estrogen in early 50s, and now women are losing progesterone so much sooner. So number one reason is increased exposure to medical environmental hormones, synthetic estrogens like birth control pills, and birth control pill contamination of our water supplies. We are surrounded with birth control metabolites for many, many years by taking those horrible meds. Also, environmental toxins can behave chemically as estrogen. So if we eat from plastic, plastic has a lot of xenoestrogens, and those xenoestrogens, when ingested, act as a bad estrogen in our body, and it can cause estrogen's dominant symptoms. Another source will be mycoestrogens. Those are estrogen found in mold, moldy old buildings. We inhale them. Also metalloestrogens that are in heavy metals. And that elegant balance of hormones in a woman and man is disrupted, and that often begins in young ages. So how do you know if you lost your progesterone? So women that usually have normal, regular periods, all of the sudden then they have irregular cycles, often heavier, sometimes shorter, sometimes longer, because regular ovulation equals regular periods. So if you don't ovulate, periods are out of whack, are irregular. Also, breast tenderness because of overstimulation of breast glandular tissues. Women that never had PMS or uterine cramps, all of a sudden they have very heavy periods, bad PMS symptoms. Breast tenderness. All those symptoms are caused by estrogen-induced overstimulation of breast tissues and uterus tissue, and that it's not balanced by calming effect of progesterone. For both genders, we notice insomnia, anxiety. So this is why I want you to understand why women after hysterectomy still should replace progesterone. Because like you see, progesterone not only calms down overactive uterus, which helps with bleeding, but also have like positive effect on breast tissue, positive effect on insomnia and anxiety, This is my favorite quote. So much good can be done by identifying early progesterone decline and or loss of ovulation and treating it with progesterone. So much good can be done. So let's look at the timeline. What happened to women and men's body once the hormone drops? So in our 40s, testosterone drops. Like I said, I see even half of the testosterone is supposed to be in our 40s. And then we start feeling like muscle wasting. It's harder for us to gain those muscle at the gym. It's harder to burn that fat. We feel very fatigued, tired. We have no libido, no sex drive. It's harder for us to maintain erection. It's harder to get orgasm. We also start having increased risk for bone loss, which we cannot notice at the beginning. Loss of fitness, and for men, increase in breast tissue, gynecomastia. And then in 40s, we start having symptoms of low progesterone, like lack of calmness, difficulty relaxing, anxiety, some mood disturbances, and insomnia. And then, because progesterone is low, we start having estrogen dominant symptoms like overstimulation of breast tissue, breast tenderness, nipple tenderness, breast fullness, for men, breast growth, overstimulation of uterus, which is heavy bleeds, heavy PMS symptoms, and heavy menstrual flow. And then we start having that estrogen roller coaster. Estrogen roller coaster is when estrogen is high and then it's low and then it's high and then it's low and it's totally doing its roller coaster. That happens in the late 40s, early 50s because of menopause, but also estrogen roller coaster, it can happen in any age. Young girls might suffer from it because they were on birth controls for many years, which are synthetic estrogens and progesterone that put them in a basically menopause stage, completely suppress their own progesterone estrogen. And all of a sudden they stop taking that birth control. And hormones are getting crazy and out of control. And then they start having that estrogen roller coaster. Sometimes this also happens after pregnancy, after miscarriage. It can also happen with fatty liver disease or other liver diseases because we cannot metabolize estrogen the right way. Remember that estrogen is umbrella term for a lot of hormones in our body, and there are good estrogens that boost collagen, lower cholesterol, make our skin and bones stronger. And there are also the bad estrogens or bad metabolites of estrogen that can lead to breast cancer and prostate cancer. So if we have some issue with our liver is stacked up, we cannot metabolize those estrogen the right way. They can metabolize it into wrong pathway, like 4-hydroxy pathway, and lead to breast cancer and prostate cancer. So healthy liver, it's very important for hormone health. So then in our 50s, estrogen finally drops after that big roller coaster. And this is when women start having those famous vasomotor symptoms like hot flashes, warm rashes, night sweats. They start having sleep disturbances, but different than the one with progesterone. It's more like nocturnal hot flashes, or their mind started racing because, like I said, estrogen balance cortisol. So women are having this high spike of adrenaline secretion at night, and they lie down wide awake and they cannot fall asleep until their liver finally metabolizes and eliminates all that adrenaline. It's not uncommon for perimenopausal or menopausal women to go to emergency rooms with heart palpitation and chest pain and being terrified that they might have a heart attack. This is all because of the dramatic drop of estrogen all of a sudden. So what happens when all hormones are low? We start having brain fog that can manifest as cognitive dysfunction, from forgetfulness to even significantly compromised memory or thinking. Like I said before, estrogen is an excellent stress hormone. When it declines, the body must rely even more on cortisol, stress hormone, for the stress response. And increase in cortisol leads to insulin resistance, and insulin resistance is a recipe for weight gain. That's why those weight gains for women and men. Osteopenia and osteoporosis, the holes in the bones. Estrogen works on bone mineral density, as testosterone prevents osteoporosis. Interestingly, this diminished estrogen has a very negative effect on bone loss around 5 years after perimenopause. That's when women start noticing like very, very brittle bone. Then headaches and even migraines. We often treat women with so-called menstrual migraines. This is usually when estrogen drops 1 or 2 times per month, and women start having those menstrual migraines because of very low estrogen. They can have it also when they're going through menopause. That's when we have to treat it with estrogen. And of course, like I said, the heart attack, vaginal dryness, atrophy for men, erectile dysfunction, low libido. But remember, it does not have to be you. We can help you before all those crazy symptoms happen. So what we can do, short answer is to take bioidentical hormones because they not only reduce medical risks, but also can change your life. You will sleep better, your mood will get better, your relationship will be better, and also your cognitive ability will return to normal. That's just a short list of positive traits of bioidentical hormone replacement. And remember, bioidentical means chemically identical to those in your body. So the same testosterone as you make, the same chemical compound, the same chemical structure, the same estrogen and the same progesterone. That's the key. And don't forget that for women, all three hormones has to be replaced and perfectly balanced for her to feel amazing again. For men, we usually just replace testosterone and sometimes progesterone because progesterone helps to prevent male pattern balding. Some small amount of testosterone will always convert to estrogen for men, a little bit because of the aromatase enzyme. We want to lower it, but not completely suppress it. That's how we balance men's estrogen. That's the key to check your blood work often and work with somebody who really knows about hormones. So bioidentical testosterone can be found in pellets form or cream form. Unfortunately, injections are not bioidentical. Bioidentical estrogen can be found in pellets and cream form as well. And progesterone, it's in oral form or intravaginal form. So what are the key points of this lecture? Find really good hormone specialists. Make sure they are like functional medicine doctors. Check your hormones regularly. Start in your early 30s to know when that drop of testosterone happens and replace missing hormones before the symptoms occur. Timing is the key. Here are the references and sources that I use to talk today. And those are my social media platforms. On Facebook, I'm Martina Erskine, longevity expert. Instagram, Martina Erskine. And also you can find us at Joe Wellness Partners. And then on YouTube, Martina Erskine, 9842. Our clinic, it's located 3333 Camino del Rio South in San Diego. Thank you so much, guys, for listening. Feel free to put any questions in the comments below. I would love to answer them. Thanks for listening. Have a wonderful day.